Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Hydrocodone. Its brand name is Zohydro ER, which stands for extended release. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So hydrocodone is a semi-synthetic opioid agonist that acts like a full agonist. Its analgesic properties are due to its action on the mu-opioid receptor. In terms of indications for use, hydrocodone is indicated to be used in the treatment of chronic severe pain in patients who require around-the-clock opioid analgesia. Now, before somebody was to use hydrocodone, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with acute bronchial asthma should not use hydrocodone unless they're in a monitored setting where the necessary resuscitative equipment is available. Patients with a hypersensitivity to hydrocodone or any other component of the product cannot use this medication. It's also not recommended to be used in patients who have a gastrointestinal obstruction. And finally, for contraindications, hydrocodone cannot be used in patients who have significant respiratory depression. Now, in terms of precautions, hydrocodone is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. Because of the impaired psychomotor function and sometimes syncope which may occur using this medication in the elderly population, they would be at an increased risk of experiencing falls, and in this population, falls can sometimes result in fractures. Patients should be made aware that severe hypotension or low blood pressure may occur. This sometimes presents as orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position. Patients would be at an increased risk of experiencing hypotension if they're unable to maintain a consistent blood pressure due to volume depletion. We would want to avoid giving this medication to patients who have circulatory shock due to the decrease in cardiac output as well as potential for hypotension. It's not recommended to use hydrocodone within 14 days of the administration of a monoamine oxidase inhibitor. Patients should be made aware that esophageal obstruction, dysphagia, and choking have all been reported with the use of hydrocodone. Decreased bowel motility may occur in post-operative patients using this medication. It's important that patients are made aware that crushing, splitting, chewing, or injecting hydrocodone may result in an overdose that could lead to death. Mental or physical abilities needed to perform hazardous tasks, such as operating heavy machinery or driving an automobile, may be limited by the use of hydrocodone. And lastly, abrupt discontinuation of hydrocodone could lead to withdrawal symptoms, so it's not recommended to stop the medication abruptly. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use hydrocodone, they can expect to receive their dose through an extended-release tablet or an extended-release capsule. For patients using Zohydro ER to treat their chronic severe pain, and they're not opioid tolerant, so this is their first opioid, they may start off with a dose of 10 milligrams every 12 hours. They can then increase the dose by increments of 10 milligrams every 12 hours, each 3 to 7 days, until an adequate benefit is realized. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using hydrocodone, so I'll go over some of those here now. Somewhere between 1 and 10% of patients may experience edema while using this medication. Up to 5% may experience pruritus or itchiness of the skin. Constipation falls between 3 and 15%. Diarrhea can happen up to 4% of the time. And nausea falls between 7 and 17%. 3 to 6% of patients may experience vomiting, and some patients may experience a muscle spasm. Up to 10% of patients may experience anxiety while using hydrocodone, and up to 4% may experience fatigue. Now, some more rare but serious side effects would be a drop in blood pressure, so hypotension, including orthostatic hypotension, a prolonged QT interval, or syncope. Some patients may experience a bowel obstruction or difficulty swallowing. And finally, some patients may experience respiratory depression. That's all we're going to talk about today with hydrocodone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.